I am Dr. Valenzuela from Mexico Bariatric Center. We are here to answer all your questions about the surgery, of course. And I received, it's the first time in my life with the Mexico Bariatric Center. We are doing seminars. The Saturday we will have a seminar with me, but today we can answer some questions about the surgery, and you can participate in the seminar this Saturday for a free, I think a free some part of the surgery, so you can participate this Saturday. But today we will start with the questions. So the first question I have here is why do I need to stop steroids? Actually, you don't need to stop the steroids. You need to continue taking your steroids. Just the medications we need to stop when you will have surgery is the blood thinners, and depends what kind of blood thinners are you taking is the time you need to stop. For aspirin, clopidogrel, it's 10 days. For another like apaxivan, who is Eliquis or that kind of blood thinners, you need just stop 3 days. So we will give a specific recommendations and indications with the blood thinners for everyone. Everyone is different, everyone takes different blood thinner, and that is one of the medications you need to stop when you come for surgery. The ibuprofen, naproxen, meloxicam, it's no steroid anti-inflammatory medications, and that kind of medication you need to stop too. But for that specific medications, we ask what kind of medications everyone is taking, and we recommend what we will recommend what kind you need to stop and what not. But the steroids is not necessary. Actually, we need you continue, because if you cut, we can have a disorder. So if you are taking steroids, you can continue taking. Okay. So the second question I have, if I have acid reflux or this problem with the hiatal hernia, can I still get a gastro sleeve surgery? Is our recommendation, if you have issues with acid reflux or hiatal hernia and you did an endoscopy before, is to get, it's better to get bypass, full bypass, no mini bypass, full bypass. But in a small hernia, and if the acid is just when you eat some spicy food, when you eat too much, but it's not all the time, it's not at night when you are sleeping, it's fine if you get sleep. But if it's always every night and you are taking omeprazole, these kind of medications to stop the acid, and you know you have a medium to large hiatal hernia, the recommendation is bypass, full bypass, no mini. When can I get plastic surgery? After the bariatric surgery, the best time to get that plastic surgery is when you finish to lose the weight loss. And we know the first 2 years after the surgery is when you lose all the weight you will lose, and then is when it's fine to get the plastic surgery. Of course, previous test to see if you are okay with the hemoglobin and everything is okay to get your plastic surgery. 2 years after the bariatrics. The next question says, Good afternoon. I get a monthly HRT shot because I am in menopause. The shot is Depo-stradiol. Can I continue to get this monthly shot leading up to surgery? Okay, the hormone replace any birth control pills we need to stop before surgery 1 month before, because we know it's condition to get clots. So please stop any birth control or hormonal replacement when you will have surgery. But after surgery, 1 month after surgery, you will be able to continue with your pills. It's been a few months from surgery and I have hit a weight stall. Sometimes the patients are just checking the weigh machine all the time and they want to lose the weight every day. So if you have, for example, 2, 3, 4 months after surgery, maybe you are a little stop, but it's not too much days. You will see in 5, 10, 15 days, you will continue with losing weight. Sometimes stop 5 days, it's normal, but you will continue. But I need to know how much time are you feeling you are not losing weight and how many months after surgery you have. It depends. So I can say exactly what happened with you. Maybe it's just normal. So can you give me a little more information, please? Is there an age limit to have bypass? No. The age, we start in 17 and we are doing even 17 to 70. It's more or less the range, so it's a lot. It's a big time to get surgery. Less than 17, I think is not enough mature to get the surgery. After 70, it depends if the patient is with good heart and it's not any big issue, big health problem. It's possible to get the surgery too. So the next question is if we do revision from sleep. Yes, we do revision from sleep, actually from lap band, sleep, if you have a mini bypass, even if you have bypass, we can do revisions too. So what is the best prevention of hair loss after vertical sleeve gastrectomy or any bariatric for hair loss? This is not possible to don't lose a hair. You will lose hair. It's about 30%, 20% of your thickness. So if you continue taking your vitamins, your protein, and you don't stop that, you will be okay. You will be with less hair loss. But even if you take strictly your medications, your vitamins and protein, you will lose some hair. But after 1 year, after 1.5 years, you will start to see you will have again your hair and more or less the same quality and quantity before your surgery. But you need to continue your vitamins, protein, biotin, everything we will indicate. If there any issue or concern after surgery, should I contact you or my? Yes, some. We always give to the patients a recommendation. So the recommendation is to check with your primary doctor every year to check your hemoglobin, protein, calcium, how is your, in general, your liver and your kidney, everything to check after surgery is every year. If you have some issues like low hemoglobin, anemia, well, maybe every 6 months it will be, since you have again your normal levels. But this is a regular check like any other bariatric surgery, not just for sleep, for bypass, for any. And we give red flags. If you have this, you need to call me. If you have a pain or vomiting or fever or anything wrong, you need to check with your doctor or directly with us, asking us, and we will recommend to go to the ER in case. But it's very, very rare, but we are all the time having contact with the patients for any question or problem they have after surgery. So my email is always in the discharge paper, so if you have any question, you can send to me a mail anytime. Over 60 years old is not an issue. We will ask for a cardiologist clearance, and if you have a clearance, your cardiologist evaluation, you will be approved to get the surgery. But all the patients who have issues like long-term hypertension, depends what kind of health issue you have. We will ask you before you come, cardiologist clearance, pneumologist clearance, or just count blood cells, regular count blood cells. It will be enough in case you had in the past anemia. We need to check if you are okay with the hemoglobin, if a pre-op evaluation with count blood cells and EKG, electrocardiogram, to see everything is good to get the surgery. Antidepressive medications and sleep medications need to be continued with that. You don't stop, don't change the doses, don't change anything. Bring with you if you come, because it's necessary to continue taking, okay? If you are allergic to anti-inflammatory medications, we will change that medication for others. We have options, so don't worry. The anti-inflammatory medications, repeat, like naproxen, ibuprofen, aspirin, meloxicam, that need to be stopped before surgery 1 week. Yes, if you have a hair burn, this means you have acid reflux. This could be a hiatal hernia, and in that case, the best option is the bypass, the full bypass. The sleep is not a good option. You need to change your surgery for full bypass. Okay, the difference between the bypass, the full bypass, and the mini bypass, it's the length, the small bowel. When we do the full bypass, we cut the stomach to perform a mini pouch, and in that pouch we count 1.5 meters, and then we put the anastomosis with the small bowel in that place. 1.5 meters with not absorption. And then the food coming to be in the small bowel directly. Down, we connect the bilis with the small bowel again, and we have 1 more meter without bilis, so it's not absorptive, that 1 more meter. At the end is 2.5 meters with not bilis, and just 1.5 with not food. In the mini bypass, we just do 1 anastomosis, and the anastomosis is in 2.5 meters with no food, but the bilis is coming to join with the food in the same pouch with the small bowel. So we have just 1 anastomosis. It's the difference between the full bypass. In the full bypass, we have a G. Here is the food, the gastric pouch with the small bowel. Here, the food is coming down through the small bowel, and the bilis is here and joined with the food here. Bilis and food. This is not in connection with the stomach. This is a small bowel, bilis, small bowel, food, small bowel, and the joint is here. It's because the name is a G and right bypass. But in the mini bypass, we have the bilis here joined with the food here, and the food coming down with the bilis again here. But it's directly the bilis running here with not stop. So we have just 1 anastomosis with the mini pouch in the gastric pouch. But in the complete full bypass, we have this separate, and the bilis is coming down. In another anastomosis is 2 anastomosis in the full bypass, 1 anastomosis in the mini bypass. And we have we know the mini bypass is a little more malabsorptive than the full bypass, but the bilis is a little in the gastric pouch. So we have 10% of probability to have bilis in your stomach, and could be an issue too. It's just in 10% of the patients, but could happen. If you don't want to get any chance to get bilis in your pouch, in your gastric pouch, you need to get the full bypass. When we start taking vitamins after surgery, we wait just 1 week to start the protein and the vitamins, because the first week is necessary to keep the stomach relaxed with the less pills. So we are giving the first week the antibiotic, blood thinners, medication for painkillers. So if we add the vitamins and protein, is too much for the stomach, recently inflamed the stomach. So we wait 1 week to start the protein and vitamin. Do we need a primary doctor before we leave the States? Before or after, you will need a doctor who asks the lab tests, regular lab tests every year at least, to check your evolution, your follow-up. So if you want after surgery, it's fine. If you don't have any issue, who be necessary to do a cardio clearance or anything before you come, it's fine if you don't have a primary doctor, but after surgery you will need to looking for. Gain half my weight back after 3 years sleep. After sleep, so can the sleep be redo to make the stomach smaller again? it's not in the bariatric surgery sleep. It's not a one option in revision surgery. The sleep is dangerous because we have this scar in all your stomach. The tissue is not appropriate to get again a cut over that it's a scar by itself. It's a tissue with not enough blood, with not enough normal tissue, so it's not possible to cut over the scar because it could be no healing in normal process and could give you narrow zones, obstructions, and that is dangerous. So the options for revision from sleep is to get mini bypass, full bypass, or duodenal switch. What is dumping syndrome and how often happen? Well, the dumping syndrome is different signs and symptoms who happen when you have discharge of your bilies, insulin, and different hormones involved in this syndrome. When you eat sugar, when you eat fat food, even if you don't have bariatric surgery, could happen, but it's more if you have bariatric surgery. Your small bowel receive this heavy food, heavy meal with glucose, fatty food, and then the reaction is to get diarrhea, hypoglycemia, diaphoresis, like you are sweating, and could be even a syncope. You can lose your conscience. It's different grades of this syndrome, and could happen if you are eating heavy foods with a lot glucose, with a lot fatty food, and it's we in the medical world, we don't know what is the patients who will have this problem. We can't know. Just happens. Some patients have, some patients don't have any, even if they are eating heavy foods. Some patients don't have, but we know between more glucose and sugar and fatty food you eat, it's more probability you have this problem. So if you have correct healthy food, maybe you won't have any problem with this syndrome. But repeat, we can't know what patients we will have and what patients we won't have. That is depends of the genetics, and that we know is you need to follow up the correct diet, and you will have less chance to get that syndrome. Okay, so it depends how heavy is your meal, and all the symptoms could be together or just one. Maybe you could have just hypoglycemia, or maybe you could have just diarrhea, or all together. So that is not all the time together. But when this dumping syndrome is severe, you will have all the signs and symptoms together. And that could control with the diets too. Okay, and it's more in patients who had the mini bypass or the more malabsorptive surgery like duodenal switch too. It's more propense to have that kind of syndrome. The medications and painkillers we use is from family of the morphine. It's not morphine. It's just from the family for morphine. The ketorolac it is non-steroid anti-inflammatory medication painkiller, and different others. We don't use oxycodone. We don't use hydrocodone. We don't use directly morphine, so it's less nausea because we don't use that kind of medication. I have asthma. Will this be an issue period? If you have controlled your asthma, it won't be an issue. We always, of course, prevent with that patients with medication. Of course, if you need nebulizer, we will do that and to prevent. And we will check you before you go to the general anesthesia to see you are clear, and it's fine if you have controlled that. Hello, Dr. Valenzuela. Debbie Faris here from 2014. Judith, my husband, and I. Thank you. Hi, Debbie. I see you are okay. That is good. If you note gallbladder inflammation, stones, or yatal hernia, do you repair? Well, for hernia, yes. The gallbladder, it's not an indication to remove if you don't have any problem with your gallbladder. If you already have an ultrasound with the stones, that is an indication to remove in the same surgery. We can't see in the surgery if you have a stone or not. That is just by ultrasound. If you had in the past pain from gallbladder and you are just suspect is from gallbladder, we can't know if we can't be sure if it's from that gallbladder. We need, for be sure, we need an ultrasound. And yes, if you have stones, it's mandatory to remove because could be an issue after surgery. And can I choose my boogie size? No. The boogie is the same for all the patients. We use 34 boogie. That is the correct size, and we don't change and we don't use a different size. Will my gastric sleeve stretch? Yes. The gastric sleeve could be stretched. If you ask for 1,000 patients who had the sleeve, you will see the same answer. In the first year, the restriction is very hard. The second is a little less. And the second year, for the next years, it depends how much food you are eating every time you eat. If you are pushing and pushing more and more and more, you will have more capacity. But if you follow up the rules, you will conserve your restriction a very, very long term, 10 years, 15 years, 20 years. But if you are pushing the food, you will stretch more and more. And you will eat medium-sized meals instead to continue eating the small portions. So you need any patient who wants to get the surgery need to know and understand that this is a tool, and need to care the tool the most time possible to the tool continue getting us the function, the restrictive function in case of sleep, to approach that restriction and stop the meals when it's necessary. With a healthy meal and the restriction, it's possible to continue your normal life with any other revision surgery in the future. I am having surgery on my wrist under general anesthesia in October. How long shall I wait to have a revision? Sleep or bypass, just 1 month is fine. 1.5 months, 2 months, it's the ideal time, because in 2 months the healing process in any surgery is finished. So we expect you don't have any inflammatory cells in your system. So 2 months, it will be fine.